I'm a 20-year practicing chiropractor. I had an office in Lemon Grove for 15 years before I joined my wife because of kids. Everything changed in my life. And I have now had the enjoyment of coming to the lovely city of San Marcos, where my wife has been practicing since 1996. I specialize in structural musculoskeletal issues. The idea of the body is the idea of function. Everything about it is getting the best and most out of it, and you find that that works the best with balance. If your car alignment is off and your tires are riding out like this, and you continually to drive with unaligned front end, is it good for the car? So, wouldn't it be better to not just keep replacing the tires, but to actually fix the alignment? So the idea of what I present to you is the idea of working and fixing your alignment and creating the opportunity of optimum health. My experience of why I got into chiropractic was to be in the sporting world. I had that opportunity by being the chiropractor for the Olympic Training Center in Chula Vista for 10 years. I worked through many Olympics and got to work with Olympic athletes where I'd watch them on the television and go, treat them, treat them, treat them, treat them, treat them, treat them. And it was absolutely a wonderful time. Also, got the experience of doing and being the official lakeside rodeo chiropractor, where I saw the most crashed human beings you'd ever imagine on these wonderful animals. And now, I didn't work on the animals. There are people that do that. I don't do that. I like my patients not to bite me. But the idea is I want to have an opportunity of getting experience with people in a very, very high impact area, and rodeos let me get some really triage experience where I can diagnose very quickly and really understand what's going on. With those type of things, it gave me a better presence in my office, which allowed me to be able to get and do wonderful things with treatments, not only with the spine itself, but with extremities. My specialties is shoulders. I do wonderful work with shoulder issues and ribs that most chiropractors don't even know what those techniques are. I have, because of working with other chiropractors in the sporting world, got to learn different techniques that were awesome. And that's one of the things that we provide is different than other chiropractors, is that we have a little higher end techniques, because I do have my post-grad education in extremity work, which is your arms and legs. So not only do I do the spine, but I do the other peripheral areas of your body. And now my wife, who I joined, Dr. Kimberly Rollheiser-Revilla, is also a chiropractor, but of a different hat. Her specialty is dealing with you from more complicated cases, people who do not do well with chiropractic or have other organ issues and failures, as well as nutrition issues. My wife is able to use her applied kinesiology background with nutrition, and with that able to do things that will look at the body from the inside out and be able to deal with the more complicated cases. You may be a cranial or have issues where you're so tight in other areas of your body, like in your head, that she can unwind your head and create changes so that when I adjust you, your adjustments hold. A lot of complaints is, well, I go get adjusted, by the time I walk in the car, I'm out of adjustment again. Well, then you're a dura person. And what the dura is the sheath around your brain and spinal cord, which gets, over time stress, tightens up like a band. And as it tightens up, it's not going to work well with anything that's trying to correct it, because it's going to stay tightened and twisted. So what we do with her techniques is allow us to untwist you so that my techniques work well. So in tandem, we are a wonderful team to really present and help change and bring quality back to your life. So I just want to explain one thing on the pamphlet today to give you a little more insight of why and what we do and why it's so important. With most of you, you have the pamphlet there, but you also were given a rubber band. If you'd be so kind as to take your rubber band, and if you don't, you can watch your neighbor with their rubber band, but take the rubber band around 2 fingers and tighten it as real tight as you can. So if you do that for me.
Wow.
Good catch, Keith. All right. Now that you've tightened that rubber band around your finger and you're starting to feel discomfort, anybody feeling a little discomfort?
Ow.
Okay, so I would like you now to medically treat that problem. I want you now to massage it. Did that fix the problem?
No.
Okay, put a little ice on it. Did that fix the problem?
No.
Okay, let's put some Neosporin on there, or steroids, or aspirin. Did that fix the problem? What's going to fix the problem?
Taking the Band-Aid off. Sisters.
Taking it off. Take the rubber band off. You just removed the nerve interference causing you pain.
And now it's causing someone else pain.
That's the idea of what we're trying to give you, is a removal of irritation. You cannot do it by simply changing it with medications or doing it with heat, cold, or massage, or even eating better was not going to fix that problem. What you have to do is simply remove that irritation. What we're removing is what we call the subluxation. This is what I do. I remove subluxations. It's a simple understanding of coming in and looking at a minor misalignment of the bones of the spine, which causes nerve interference resulting in a loss of health. So when you come in your evaluation, I'm going to evaluate you for this. This is what I do. And once I figure out that this is causing problems in your body, I can then change it by doing a treatment protocol that will remove that subluxation, which will open up the nerve interference and restore health. It's a pretty simple concept. We work so hard in trying to figure out our health, you know, by eating right and exercising, things like that, and those are absolutely necessities if you really want to live quality life. But when your function isn't optimal because environmentally you've had stresses. Anybody ever had stress? Okay? Now stress is a concept of not only just being physical stresses. Okay, there's chemical stress, okay, and mental stresses that are the combinations of building blocks that cause the subluxation. Okay? Your first subluxation was when you were born. Okay? It was pretty tough coming out of that little hole. Okay? From that point on, you tried to learn to stand and fell 332 times in one day. Okay? Accumulation of stresses like that build up to the point where then you became a desk jockey and you sit like this now and you do this all day. And you wonder why my neck always hurts. Okay? That accumulation of those type of things are build-up of stresses which create the subluxation. What we do by looking for this problem is to remove that irritation so that your function can be restored. When do you all know how you have that cavity in your tooth?
Pain.
Right. Okay? Or you went to the dentist and you checked it and he said, you have a cavity. Because you want to get it before it hurts, don't you? Because if you keep waiting and waiting and waiting, it turns a cavity into what? What's your favorite thing to do at the dentist?
Root canal.
Root canals! So do we like to wait for the root canal?
No.
Oh, we don't. So we don't want to get to a point where we require a very painful and discomforting procedure to be done. Wouldn't it be better served to be finding out the problem before it becomes a problem? Because unfortunately, when do people find out they have cancer? Diabetes, thyroid conditions, blood pressure issues. Right? You find out when, well, I just found out with the doctor, tell me I had cancer. You didn't see it. Normally, a lot of the times you can't feel it, see it, or know it's there, right? Why do we want to wait until, holy Christ, I got a 40-inch lump in my body, and yeah, I knew I had the problem. Okay? Why wait till you have the problem? Okay? You don't want to wait for your dentist to tell you you need a root canal, do you? So what is it that why I push the idea of coming to the office to get checked is because it's easy to understand that you can have a vertebral subluxation which will start putting you into degenerative changes and you not know it because you don't have pain. But when the pain comes, guess what? It's a problem. And your health is going to diminish. And I'm going to leave you with this idea is that studies have shown by 2050 there will be 4.5 million Americans over 100 years old. Yes, you probably are. Most of the people in this room are going to be closer to 100. Okay? Your grandparents at the turn of the century were born at a life expectancy of 60. They're all 80. So if you take that concept, we're now going to go to the next level, which is going to be to 100. You may be alive to 100, but it doesn't mean you're living. Quality is set by a body that functions well. You need the nutrition. You need to have the exercise. You need to have all those aspects there. But if your spine is not aligned right, causing nerve irritation, you can do all those things and you still will not get quality of life. That's why you need to get checked. Put your butts in there. Don't waste time. Dr. Russ Rivella,
Questions for Doctor?
Yeah.
Questions?